So how do you propose then, if you think iodine has been one of the driving forces for thyroid disease, and you're talking about a diverse range of thyroid diseases, right?
Well, we know in terms of, so there's two ways to think about that. There's relationship in causing disease, and then its relevance and then reversing existing disease as far as adjusting it. And those don't always overlap. So we know, for example, that iodine may be a factor in developing the risk for thyroid cancer, but there's no data saying that changing iodine changes existing thyroid cancer, for example. But we do have pretty good data saying that in the case of known autoimmune hypothyroidism, overt hypothyroidism, subclinical hypothyroidism, and autoimmune hypothyroidism, that roughly 60 to 80% of adults per the study stand to fully reverse the disease by iodine regulation. We've had multiple clinical trials showing this. And we also see that those on thyroid medication, there have been a couple of trials looking at how well they can deprescribe or lower their dosages if they avoid extra iodine. And papers have shown that when that's taken into account, about 84% of people, even if you leave in those who are overtly hypothyroid, can substantially lower their dose with no adverse effects. And around half of that same group can eliminate their medication with no adverse effects.
Okay. I know there's a huge rise in autoimmune hypothyroidism. Is there a huge rise in thyroid cancer as well?
Yes, they've both gone roughly in parallel. And as I was saying, roughly tripling over the last 2 to 3 decades.
And do you think the thyroid cancer could be related to the high level of iodine?
There's a lot of factors that can be one. That can be one risk factor. Basically, to take a good mechanism in place, iodine is an oxidant. Think about like bleach, think about hydrogen peroxide. We put all those things on the skin to kill infections because they're pro-oxidants. They create a free, unpaired oxygen that causes free radical damage. And if you've got a bacteria trying to get its way into your body, that's awesome. You want to damage its cell wall. That's a good thing. But the problem is that when you get a little extra within your thyroid, that free radical damage recruits your immune system. And you start to damage the proteins, the enzymes of your thyroid, thyroglobulin, thyroid peroxidase, and the lymphocytes become activated and they start to attack those same structures. So that's the main known mechanism of action for developing autoimmune thyroid disease.
Wow. Okay. And I guess the good news is that it's very reversible.
That's the exciting news. One study that I've mentioned before took people who had some of your audience, their TSH scores were averaging 14. What that means is that they were overtly hypothyroid, well outside of range, not subtle. And they had been there for about 6 to 12 months on average. They were pretty stably there. They weren't given medications. The only intervention was they were tried to get their iodine below about 100 micrograms per day. They all had marked signs of autoimmunity. Within 3 months, 78% had completely normal thyroid function again with no other changes. And of the people that didn't get better, of that 22 odd some percent that didn't improve, there was a couple of categories. So one big category, they weren't compliant. They didn't get to the low iodine target. So yeah, but another category, they did comply and they did improve, but they didn't completely normalize. So many of them had scores that were, 50 or 200. They were way, way, way outside of normal. And they improved markedly, but in that time frame, they didn't yet get back to normal. So they didn't fall in the 78%. So if you change the definition and say, okay, of those who did it, how many either were reversed or got a whole lot better, then that was actually 97%. So yeah, it's been just staggering how helpful it can be.
That's incredible. Why is this information not available yet? I mean, it seems like to most people, even healthcare.
That's a question I ask myself rather frequently.
Are you the only voice?
I appreciate being on your podcast to help make it more available.
Right. Are you the only voice talking about this?
Others have joined in, but ego aside, I did really start this discussion. Yeah.
I see.